Yeah. So, hi everyone. I welcome you to today's session on pregnancy planning by Apollo Credit. To speak on the topic today, I would like to welcome Dr. Nitya Babu Kumar from Karapakam. She is our in-house senior consultant, obs and gynecologist. She's done her MBBS, DGO, DNB, OG, and MNEMS. We welcome you, doctor. You can take over the session now.
Uh, thank you so much. Hope I'm audible to everyone. Yes. Today is like I've come here to speak about planning pregnancy. Many of them have a lot of confusions. Say when to plan pregnancy. The couples, when they meet their gynae, they have 100 questions in hand. First thing is they're more anxious. Second thing is like whether they are financially stable. So third thing is like whether they are physical, their body is like ready to accept a pregnancy. So like this, they have a lot of question in mind. So I have come here with few discussions. Say most of the thing I'm going to omit. I'm not going to speak a lot, but most of what is the main component, main concept you want to understand before planning pregnancy is what I'm here to say. So first thing is why do we plan pregnancy? See, at the end of the day, to have a healthy baby, healthy, happy. Most of the women say they want a chubby, nice, fair baby, will I get, etc. So healthy mom and healthy baby is what all need as a gynecologist from my part as well as from the couples. So first thing, to plan a pregnancy, you should be physically fit. Second, you have to be mentally healthy, mentally prepared to anticipate the pregnancy, to anticipate any complication during pregnancy, delivery, in labor, as well as postpartum. So the main thing is like 4 out of 10 women, married couples, usually they without planning pregnancy, they directly become pregnant. Say rather say married after married, maybe a month or the second period usually will be missed. They'll come with a urine pregnancy test showing positive. They say we didn't have any planning before and we wanted for abortion. So this is sort of a critical situation, like both for them as well as a guy like can't do repeated abortions for them. So you have to plan well ahead before having relationship, before knowing their cycles properly, to mainly to avoid unintended pregnancy. Planning pregnancy prior not only helps the couples but also prevents prenatal deaths, that is death for the baby. What to say, most of the stillbirth, most of the that is what is stillbirth is like during the process of labor when the baby dies. So most of the stillbirth, most of the congenital anomalies are common when there's no planning before. So one can prevent 50% of such complications if you plan early, plan priorly, both the couples sitting together and discussing. Okay, so um, so let I once I'll say when is the correct timing for the couple to go to the gynecologist or any physician, say, so that they can have a clear information about pregnancy and all. First thing is like as soon as you're getting married or even before that, if you're planning to engage, etc., you can well ahead go before and do a health check. That is called perimarital health checkups. You can have a health check to know how you are physically fit. If you have any abnormalities or any even genetic related diseases also. So, or else after marriage, as soon as your periods gets over, you have to meet your gynae and you can ask questions regarding your physical health, regarding your sexual health also. So first thing is like if you meet your gynae, what do they say? They say about they ask few history, family history of diabetes, hypertension, thyroid, asthma. Why is these medical history so important? So this medical history, once prevalent in family, can affect your, I mean, the couples also. Say if the women, if the female, that is the spouse, the mother has a family history of diabetes, then during pregnancy, she also can have gestational diabetes. If the mother's family has hypertension or certain genetic disorders, definitely her baby also can get affected. So family history is very important before planning pregnancy. So what do I do if I have any genetic related disorders? What my family has some inherent disorders, say autosomal conditions, Down syndrome, etc. So in that case, definitely you need a genetic counseling. So you can meet your gynec. She will guide you to a counselor. So you can have a genetic counseling. Most of the family history, except for autosomal dominant or recurrence history, will not occur again. So you have to be make sure that what to say regarding genetic inherited disorders, you can do a blood investigation, a karyotyping, a well ahead before planning pregnancy. Second thing is like apart from family history, your personal history. So personal history says past history of asthma, past history of thyroid, diabetes per se, past history of any chronic illness in you. So this all will be noted by your gynecologist. So how does each one play a role? I will tell later. So each one how to take care of. Okay. Then your body mass index BMI, which is very very important. So you have to be in a correct BMI before planning pregnancy, I would say. Then your immunization status regarding your rubella vaccination also. Though you have received MMR in your childhood, make sure you have a rubella vaccination and don't plan pregnancy 3 months after vaccination. Then the history will be about alcohol and smoking and either chronic medications you're taking into. Say for hypothyroid, chronically you're taking certain medications for Scheer disorders, anti-epileptic, antidepressant. These drugs should be precaution and said to your doctor prior planning pregnancy. Okay, so certain age-related risk factors are there, which also should be noted. So I would say plan pregnancy earlier. So coming to age. So when is the correct ideal age to plan a pregnancy? This is the first most question they ask. So for the first pregnancy is better less than 30 years. But nowadays, because of the assisted reproductive techniques, that is IUI and IVF techniques are more common in the market. So advanced age people are becoming more pregnant. But if you're planning for pregnancy, natural conception, say less than 30 years for first pregnancy and 35 for second pregnancy. So, as age advances, one thing you should fear of is age-related medical disorders. So, what are the main thing I should focus when I'm say for example, I am 29, I'm going to reach 30 next year. Can I plan? Definitely yes. Plan within 29 so that you'll deliver by at least 30 years. What are the things you have to take care for age-related age as your age is? First thing is like medical condition. Second thing, you do a ultrasonography. Make sure your uterus and ovaries are healthy. What the say for uterus, you can have a fibroid uterus because as age advances, fibroids are more common. You can have any cyst in ovaries, polycystic ovaries, or any other simple ovarian follicular cyst. Anything can be. So you have to do ultrasonography. Make sure your uterus, your ovaries are healthy. Second thing, you can also do a investigation, that is hormonal panel. So if you're 29, 30, do a hormonal investigation on day 2 of your periods. Make sure your hormones are fine. Say female hormones, FSH, LH and all, AMH. Make sure it's healthy and make sure it is in the normal level. So once these are normal levels, you can well ahead plan pregnancy. If there's any hormonal imbalance, definitely you have to meet your gynec, take necessary investigation, balance your hormones before planning pregnancy. So, how to balance is mainly lifestyle factors. So, that also I'll discuss in subsequent sites. So, regarding age, this is the ideal age. For planning second time, what shall I do? So when you're planning for the second time, the same thing is applicable. Meet your gynec if you are 34 or 35, do the necessary investigation, do a ultrasonography, and then plan. Second, okay, then plan. So next area to be addressed before preconceptional care is the nutrition. The couples asks what kind of nutrition should I have before planning pregnancy. Do I have to do any special investigation to know my nutrition level, say iron, my vitamin D level, my ferritin, etc.? I would say yes, of course. You need a complete panel of complete panel of investigation also before planning pregnancy. Say you may be vitamin D deficiency. You can even have a calcium deficiency. So this all is very, very important for planning pregnancy faster. So first screen for anemia. Do a hemoglobin test and make sure you are not anemic. So first screen for anemia. Then you can supplement yourself with iron or folic acid tablets or diet. Then you can have any protein diet. Okay. So I will tell you a few things what all to eat to have a healthy sperm and healthy egg. So first thing is your folic acid. So folic acid is very, very important in your diet. So folic acid usually it will be given as a supplement by your gynecologist. Apart from that, what are the food substances which is rich in folic acid is mainly green leafy vegetables. So green leafy vegetables and certain salads what you use like broccoli etc. So certain salads also were very rich in folic acid. Okay. Folic acid 5 milligram per day prevents neural tube defect. Folic acid should be taken routinely 3 months prior conception, but should be followed up to 12 weeks once you even if you're pregnant. So folic acid is a preconceptional micronutrient which is essential before planning pregnancy. Next is iron. So iron is important because iron is the only mineral which is shuttles oxygen in your body. So when you're planning pregnancy, you should have good quality of eggs. So good to have a good quality of follicles. Definitely, iron is essential. So iron can be gotten green leafy vegetables, non-vegetarian sources of iron are liver, meat, etc. So even vegetarian sources, you can have dates, you can have amla, all with all vegetables are basically rich in iron. So iron is essential before planning pregnancy. Next come the calcium. So calcium helps to conceive faster. So calcium diet basically is milk. So milk is easily available. So you can have say 1,000 gram of calcium from having 200 like what to say 500 ml. So 2 cups per day you can have to have enough calcium. Those who don't like milk, what do? They can have ragi. So ragi, millets, all good source of calcium. Even yogurt, you can have calcium. Mushroom and all vegetables. Some vegetables do have calcium in it. Third thing, most important is proteins. So fourth one is proteins. So proteins is also essential to have a good quality of embryo. That is good follicles and sperm. So protein by nature, what you can have is like soak few badams at home, say 8 to 10 badams at home. Have it the next day after peeling the skin. So badam is a good source of protein. Even non-vegetarian, you can have meat. Chicken is also a good source of protein. Having boiled egg, only white yolk. Having 2 boiled eggs per day, only a white as good source of protein. So apart from that, dal, legumes, everything has good source of protein. So protein is also essential. If not, you can have supplementation. So as I said, folic acid, even proteins, you can have supplementation. So meet your gynec, know about the nutritive values, get a diet chart. So you modify your lifestyle and diet accordingly. Next is what are the genetic conditions I can know of is like I said, no genetic counselor you have to meet, do a carrier testing and screening, get the appropriate treatment then and there. So third thing is how to prevent unwanted pregnancy, how to prevent early pregnancy, how to prevent recurrent miscarriages. That is also they ask. So before planning pregnancy, what are the things I should do to avoid recurrent miscarriages? So same thing. First is age. Most of the time, adolescent girls, say 20, 25, early adults also plan pregnancy as soon as they get married. When they are in 21, 22, they wanted a baby soon. So coming to this early adults, what are they lacking? Most of the time they lack iron. So when there's iron deficiency, obviously recurrent abortions can occur. They can have heavy bleeding also. So their uterus per se is like they usually refer the term as they are very weak. There's no such entity called weak uterus. Rather saying their immunity level, their standby power is very less. So in these girls, early adults, kindly delay your pregnancy up to like say 25 or 26. I would say 25, 26, maximum 27 is the ideal age a girl can become pregnant when she's mentally and physically stable. So, educating the women and the couples about dangers of having their baby and also the short birth interval. Say, I've seen so many people when they're 22, their first child, 24, their second child, they come like that, and 25, they finish their family. So, the physical and the mental torture she may undergo, all this should be educated so she can have a counseling before as soon as she get married. Then she can ask about her gender, how is she physically fit, whether she can have a baby. Then she'll plan later. In such cases you can have contraceptives like pills or copper tea or anything so that they can prevent this unintended pregnancies. So these teenage girls, I said, apart from nutritional issues, anemia, emotional instability, and social issue, what are the most medical conditions also? So these young girls also can have hypertension during and Down syndromes. Down syndrome is like I said, no chromosomal disorders. It's a trisomy 21, and as it can occur in any age, as but more with advanced maternal age. And so there's increased risk of down babies when there's an advanced age of more than 35, 36, and 40 and above. So screening for this down syndrome is also available. So I've asked, excuse me, there are a few questions here in the chat. So first question is like, is there any age range during which we should plan pregnancy, which I discussed now? Any precaution we should keep in mind except family history? What regarding what do you want, what precaution except family history is like I want to know whether any genetic conditions. See, once it runs in family, you can have, if it is a recurrence history, definitely you can have the same disorders. Say any congenital abnormalities in the heart or kidney problem, polycystic kidneys can, certain autosomal dominant do runs in family. Any inherited disorders definitely can carry over. Apart from that, I said that you can do a karyotyping and no more. You can do karyotyping and make sure it's not inherited. Any precautions to keep in mind if you have irregular periods? Irregular periods is like there's a lot of things in case of irregular periods. Say first thing is you have to rule out hormones, especially hypothyroid. Hypothyroid can cause irregular periods. Hypothyroid, if untreated and if the normal level should be less than 2.5 before you plan a pregnancy. If that hypothyroid is not corrected, you can have recurrent abortions. Not only recurrent abortion, second thing, low IQ babies. So thyroid is very, very important. The same as diabetes. Your sugar levels should be controlled before planning pregnancy. What are the certain things you have to meet a gynec well ahead before planning pregnancy apart from thyroid, sugars, any chronic illness, or you're taking any medications, any seizure disorders prior, you're taking any medications for that chronic medical condition, past history of any IUGR, stillbirth, any drug exposure, radiation, etc. These all definitely you have to go ahead and plan, meet the gynec and plan thing. Because in hypertension you would take certain medications which is very well contraindicated in pregnancy. You have to either stop those hypertensive medications, switch on to easier one. The same so for antidepressant and seizure disorders. You have to change the drug medications, meet your neurologist, and then only plan pregnancy. So irregular periods can be due to hyperthyroid. You can have even a polycystic ovaries. So coming to this PCO, you know, lot of hormone imbalance causes this PCO. When these hormones all imbalance, recurrent abortions can also occur. So you have to control the PC polycystic ovaries. Make your cycles regular. At least 3 cycles should be regular before planning pregnancy. Okay. And regarding exercises, mild and moderate exercises essential so that you bring your BMI down before you planning pregnancy. Make sure either you go to a gym or do a yoga, physical exercise. Avoid stress, especially. If too much of stress, definitely you have to bring down the stress before planning pregnancy. Any more questions you have? You want to conclude the session? Okay. Thank you. Thank you.
Thank you, doctor. It was a very informative session.
Can you hear?
Yeah, yeah, I can hear you.
It is still in live.
Yeah.
Okay.